What is up, guys? Welcome back to the channel. Just kind of want to do a quick little video. We're approaching the holidays, as y'all are all aware of. Anyways, normally during the holidays and approaching holidays is a very busy time for us in the EMS field. Already heard about a lot of good wrecks, taking a lot of fatalities here. Just want everybody to know that just because you're off work from your regular 9 to 5 job or 8 to 5, whatever, and you're at home with your family on the holidays, to think about everybody on the ambulances, the fire trucks, the police cars, the hospitals. These people are out there making a difference for somebody. Also, if you see anybody in the street, just tell them thank you for the service. It does make a whole lot of a difference to them. I mean, you don't know what we see. By the time you see us walking down the street or riding in our truck, we probably work the worst call in the world. And just some little positive interaction with the general public really means a lot to us. So if you just see anybody out there, just a quick thank you means the world to us. Anyways, I also wanted to talk to y'all about what it means to be a paramedic. Some things you have to go through. To become a paramedic, you must go through an EMT basic course, which most places is 1 semester. And then when you get out of your class, you have to go and take national registry if you're a national registry state. If you're a non-registry state, I'm assuming you do a state boards test. I don't know. As you can see, I'm a registry state. Anyways, and my advice is once you get your EMT, to go work at least a year on the truck full time before you go to paramedic, because it's a lot to learn. Because now it's a condensed course, 1 year, and you're out there pushing drugs, doing all kind of advanced procedures, and you really need to be on top of your game, and you need to be a very good EMT to have success at the next level. There's a lot of good medics out there, a lot of good EMTs, and right back, there's a lot of bad medics, bad EMTs. But, you know, when you're sitting there, when people think, when they call it ambulance, it's just a ride to the hospital. It's just a taxi, just Uber, if you will. No, we're much more than that. We are an extension of an emergency department, so to speak. We can put a tube down your throat. I can breathe for you. I can stop your heart. I can restart your heart. I can push any kind of drug in between to do anything. I can see if you're having a stroke. Well, I don't have like the machines, but I can do tests, like this little Miami stroke scale and the fast assessment. Anyways, there's different little things I can do. I can tell you if you're having an MI, stuff like that. I can put you on CPAP. It's just a lot of things we can do on these trucks, man. It's just ridiculous. And people don't understand when you call the ambulance and the ambulance is working on somebody, they're like, well, just take them to the hospital. That's what you're here for. No, if you want to just go to the hospital, you get in the car and go yourself. You called us for treatment, and we're coming out here and treating you, and we'll treat you, and we'll go to the hospital, and I'm going to continue to treat you on the way to the hospital. It's not just, I'm here for convenience. I'm going to pick you up to the hospital so you ain't got to wait in the waiting room all night. We are here because there's a medical emergency, and we are here to take care of a person in their time of need, and we're going to do what is required of us to make sure that person, hopefully we can get them to improve. You know, that's what we're aiming for. But sometimes things happen. Sorry about that. Anyways, I don't know, it's just, you work in this field and you get called to these houses and you get called to this, called to that, and people just be like, just take him to the hospital. It's like, no. I mean, I'm going to, don't get me wrong, but I want to do what is required of me because you called me to assist you. I'm here to help you. Let me help you. Let me do my job. I'm here to do, if it involves getting cardiac monitor, if I need a 12 lead, if I need to check your blood sugar, if I need to check, your pupillary response, your oxygen levels, Do I need to start an IV? Do I need to intubate you? Do I need to breathe for you? Do I need to pace you? Do I need to cardiovert you? Do I need to defibrillate you? Do I need to push drugs do I need to push adenosine, atropine? Do I need to push epi? Do I need to push some kind of narcotic? Do I need to give you some antiemetic? Do I need to give you blood, like dextrose 50 or sodium bicarb? What, just et cetera, et cetera, et cetera. I mean, I'm here to help you, and there's certain things I have to do. So for the lay people out there that just don't know, they think, oh, they're just a ride. All we're going to do is just sit there and just pass somebody's hand on the way to the hospital. Yeah, that's not every time. There might be some calls that don't require us to do anything. You just, but a lot of it is bedside manner. Now, don't get me wrong. But, you really need to get out there and let the crews take care of their patients. And when you see the crews working on their patients, tell them thank you. Be very appreciative, because y'all don't know what we go through. Y'all don't know what we see, what we deal with. Because not only do we have to deal with whatever's going on around us, which can eventually cause us PTSD and stuff like that, we're under so much scrutiny with our documentation and making sure our ambulance services are getting reimbursed and we're getting everything covered. So if anything goes to court, we're covered on what we've done. It's just a big headache. And I love what I do. It's a very rewarding field, and I love making a difference. There's nothing better in the world to go out there and get somebody who's about near on their deathbed, and you do what you can. You maintain them or improve them. Take them to the hospital. Don't matter if it's 30 miles down the road, 10 miles down the road, 100 miles down the road. I've done it all. I've even flown some. Call the helicopter in and be like, because we're too far, we need to go somewhere now. And then a couple weeks later, you see that person walking up down the aisles of Walmart, and they look at you, and it's like they know who you are, but they're like, I don't know where I know you from. It's just a reward, in fact, to see that person up and walking around. I know I'm kind of rambling, but just a video I kind of want to make for a little bit. I know it ain't nothing special, but just something, the public needs to be educated on some stuff, and there's not a whole lot of publicity and education out there for ambulance stuff, EMS stuff related anyways. But anyway, guys, thanks for watching. Do me a favor, check out the Hillbilly. I want you to also check out First Responder Medic and kmnremtp. These are all good guys, good content on their channels. Anyways, peace out, guys.